Mountains Beyond Mountains by Tracy Kidder is a compelling biography that tells the story of Dr. Paul Farmer, a renowned infectious disease specialist who dedicates his life to providing medical care to the poor and underserved in Haiti and other developing countries. A mission inspired by injustice. In Tracy Kidder's Mountains Beyond Mountains, we meet Dr. Paul Farmer, whose mission is driven by what he calls an impatient perfectionist's desire for justice. Born to a humble family, Farmer's journey leads him to Duke University before ending up at Harvard. The book shifts focus to Farmer's work in Haiti's Central Plateau amidst a tuberculosis outbreak. Farmer found that many patients who were given medication often failed to complete their prescriptions to the end, mostly due to poverty-related barriers. Empathizing with their circumstances, Farmer introduced directly observed therapy short-course DOTS, a health delivery model that brought medical care directly to patients' homes, ensuring they received and completed their treatments. Battling resistant tuberculosis. As the book progresses, Farmer faces a new challenge. He encounters multiple drug-resistant tuberculosis MDR TB, a disease with expensive and complicated treatment protocols. Unfazed, Farmer fights to adjust these protocols to the harsh realities of patients living in poverty. He believed that everyone, regardless of their social status or location, should have access to a preferential option for the poor in healthcare. Farmer's next battle brings him to Peru, where he works closely with the World Health Organization, WHO, and the Peruvian National Tuberculosis Program. Nonetheless, there's a stark contrast between these organizations' approach and Farmer's. While they strive for cost-effective methods, Farmer insists that the most effective medicines, though costly, must be made available to the poorest patients. Pushing boundaries in global health. Mountains Beyond Mountains narrates how Farmer's views, initially deemed radical, eventually influence major policy shifts in global health. Farmer rejects the common belief that second-class treatments are acceptable for the poor. He insists that proven but expensive remedies ought to be the standard care for the world's poorest patients. His relentless advocacy eventually convinces international bodies like the WHO to revise their policies on treating MDR TB in poor countries. Farmer's work doesn't stop at overcoming MDR TB. He associates the treatment of infectious diseases with the battle against social injustices. To Farmer, disease in impoverished societies is not just a health problem, but a symptom of deeper social irregularities. For more impactful and lasting change, he argues, both health and social systems need simultaneous addressing. Unending efforts for equity in global health. The book concludes with an overview of Farmer's ceaseless efforts towards equity and global health. Not content with his victories, Farmer incorporates new projects such as tackling HIV in rural Haiti. Additionally, he bolsters new initiatives aimed at battling systemic inequality, spreading his pioneering vision of health care delivery to Rwanda and Lesotho in Africa. Ultimately, Mountains Beyond Mountains is more than just a biography of Dr. Paul Farmer. It's a chronicle of an extraordinary, tireless battle against inequality. The book articulates how farmers' relentless fight for health equity steers the conversation from policies and statistics to the human beings behind those numbers. A riveting read, it inspires the reader to question and challenge existing norms in the hope of building a more equitable world.